Everybody, welcome. Let me get the microphone straight. Welcome, welcome, welcome. There goes the lights. We're looking better. It's Monday after a crazy weekend, and I just did a Facebook Live just a few minutes ago. And I would suggest to go on our Nutrition Shop website, go watch that. Some of the basics is just my thoughts after watching the news over the weekend and all of the different scare tactics, and even some of my colleagues that are out there using some unfounded concepts. I try to give it a simplistic 1 through 10 approach. So by all means, go watch it, thenutritionshop.net. Follow us on that Facebook link and just watch it. I'm going to try to do a Facebook thing every day this week. Today, on this show, our YouTube channel, where we're trying to build a whole library of different topics. This one's dealing with breast cancer. And I want to talk about breast cancer survivors. Praise God, there's a lot of them. And there's a lot of new techniques, particularly one new drug called Ibrance. I think that's really cool. Like if I said, what's my last name? It's Brancewitz. And if I put the letter I in front of it and just cut off the end, it's Ibrance. Spelled the same way. But anyway, it's a new drug that's used with some estrogen blockade that's doing an amazing job of saving lives. So when we look at that and we say, okay, so you know, and I'm sure you know somebody who is a breast cancer survivor. Hallelujah. What are they doing to proactively support themselves now? Because what we know is the reoccurrence rates of breast cancer in breast cancer survivors is nearly double what it is for the normal population. Something goes amiss. So this new article that came out January 17th, just about a month ago, that I've been hanging on to do this show today, talks about the use of Prilosec, Nexium, Protonix, that whole category of acid blockers. And what they found was, did it increase the risk factors for reoccurrence? Maybe not. But did it cause a major side effect with breast cancer survivors? The answer was, yeah, it did. And when you have somebody who may be in their 20s, 30s, 40s, 50s, 60s, 70s, or any period of time where they've had whatever therapy from a mastectomy to just estrogen block or a lumpectomy or whatever technique you've gone through, you typically see this problem with concentration and memory lapses because your hormones are off. So let me read this article as it stands. I'll have some closing thoughts toward the end of this. Acid reflux drugs that are sometimes recommended to ease stomach pains during cancer treatment. Let me say this, about 85% of people that are prescribed chemo or chemo or other therapies during the course of breast cancer treatments are also usually given an acid blocker because they're tough on the tummy. Acid reflux drugs that are sometimes recommended to ease stomach problems during cancer treatment may have an unintended side effect: impairment of breast cancer survivors' memory and concentration. New Ohio State University research shows an association between breast cancer survivors' use of proton pump inhibitors, PPI'S, and reports of problems with concentration and memory. On average, cognitive problems are reported by PPI users are between 29 and 30% more severe issues than any other. PPIs are sold under such brand names as Nexium, Prevacid, and Prilosec. The study, the first to look at PPI use in breast cancer survivors, used data from 3 previous Ohio State clinical trials examining fatigue, a yoga intervention, and vaccine response in breast cancer patients and survivors. In each of those studies, participants had reported their use of prescribed and over-the-counter medications and rated any cognitive symptoms they had as part of a routine data collection. After controlling for a variety of factors that could affect cognition, such as depression or other illnesses, types of cancer treatment, age, and education. The researchers found that PPI use predicted more severe concentration and memory symptoms as well as a lower quality of life. A lower quality of life. But the doctor gave it to me to give me a better quality of life. Whoops. The severity of cognitive problems reported by PPI users in the study was comparable to what patients undergoing chemo had reported, called chemo brain, said Annalise Madison, lead author. PPI non-users also reported problems, but were definitely getting better. Based on what we're seeing, we don't know if PPI users might not be able to fully recover cognitively after chemotherapy. They may not be able to recover. What kind of life are you going to have? Well, you saved your life by going through chemo and radiation and surgery. But then I lost my functionality up here. Studies published online in the Journal of Cancer Survivorship. Dr. Madison pursued the study based on her knowledge of PPI's known potential to bypass the blood-brain barrier and previous research suggesting that off-label use of PPIs in cancer patients may increase tumors' responsiveness to chemo and protect the digestive system from the ravages of chemo drugs. Can't deny that. I thought there could be a cognitive effect from taking PPIs, particularly in this population, because breast cancer survivors are already at risk of cognitive decline. PPIs are over-the-counter and generally considered safe. One of the biggest misnomers that I have seen in medicine. And so there haven't been many long-term trials. Yes, there have, dear doctor, especially looking at cognitive outcomes, because nobody was really thinking that there would be a downstream effect. As part of her graduate program, Madison works in the lab of Janice Glaser, professor of psychiatry, director of the Institute of Behavioral Medicine at Ohio State. For this work, Madison conducted secondary analysis of 3 earlier studies examining inflammation's connection to breast cancer treatment and survivorship. Data from 555 women in those earlier studies, 88 of whom reported taking PPIs, were used in Madison's analysis. The women in the previous studies had provided self-reports of PPI use and cognitive symptoms for multiple times over varied periods of time, depending on the design of the study. Women in the studies looked at fatigue in newly diagnosed patients and investigating yoga's effect on inflammation and fatigue in survivors who had completed questionnaires. Madison's analysis found on average, PPI's users' concentration problems in the fatigue study were 20% more severe than those of the non-PPI users. In the yoga study, PPI concentration problems were 30% more severe than those reported by the non-PPI survivors. In the third study, which featured data from the placebo visit of a typhoid vaccine trial, reported memory problems were 28% more severe in the PPI users. The fact that this study found similar effects across 3 different sets of patients who are at different stages of cancer survivorship gives weight to what we're seeing. The U.S. Food and Drug Administration has approved PPIs for short-term use, 3 weeks or less, to treat common gastric conditions. And they go on to say a longer use for gastric ulcers and disorders involving excessive acid secretion. Really not FDA approved, however, it's still done. People have been on these things for decades. Madison noted that off-label maintenance use of PPIs in cancer patients can last a long time. Her analysis showed that at least 2/3 of the breast cancer survivors using PPIs had taken them for up to 2 years. Madison stressed that the study shows a correlation between PPI use and cognitive problems in breast cancer survivors, and that a clinical trial controlling PPI doses and obtaining objective cognitive data would be required to find a causal effect. Science Daily, if you want to look it up. Cognitive problems of breast cancer survivors on proton pump inhibitors, the Journal of Cancer Survivorship, January 17th, 2020. You need help with this or anything else, or trying to get off of one of those things? If that sounds like you, give us a call. 678-228-8900, 678-228-8900. Just a couple things that are still in the news that I just thought I'd share at the end of the show. A promising approach to lowering healthcare usage among so-called super utilizers apparently doesn't work. According to an analysis in New England Journal of Medicine, the approach known as hotspotting uses local hospital records to identify patients with multiple admissions and medically and socially complex conditions. These patients are likely to cause large expenditures within a system. In a randomized study, some 800 patients were assigned to either the core model or usual care. The group's readmission rate within 180 days of the study entrance served as the primary outcomes. Readmission rates didn't differ between the groups. Both came in 62% of the time. Now, on the heels of the breast cancer study, U.S. cancer death rates show the biggest annual decline ever. The mortality rate from cancer in the U.S. had its largest one-year decline ever from 2016 to 2017. Notice how far behind we are in collecting data. 2.2% decrease, according to the latest cancer statistics. The reduction was largely attributable to a drop in lung cancer mortality, but even so, lung cancer still accounted for the most cancer deaths in 2017. Among other findings, death from the next three most common cancers, colorectal, breast, and prostate, showed large drops between 91 and 17. However, after 2008, reductions in death from female breast cancer and colorectal cancer slowed, and prostate cancer deaths plateaued. We're not making much of a way of an improvement. Deaths from melanoma showed a large decline, owing in part to novel immunotherapies. The large decline, 29% in overall cancer deaths between 91 and 17, resulted in an estimated 2.9 million deaths averted. Hallelujah to that. COVID-19 cases pass 100,000 worldwide. CDC advises postponing cruise ship travel. I'm sure you don't want to hear more about that. FDA approves a new treatment for Cushing's disease. Osiladrostat to treat adults with Cushing's, oral tablets. Italy in lockdown, we've heard that. I don't even want to go into that anymore. Tomorrow on the show. Tomorrow on this YouTube channel, Your Daily Dose, gut health. We're going to go back into that again. I still think it's one of the most important things you can do to protect you against any kind of inflammatory condition or any kind of viral load. The common bacteriophage, talking about gut viruses, only appeared recently in the human gut. So, has something changed in our systems recently that's contributing to this COVID-19? Make sure you're with us again tomorrow. Again, to reach us here in the office, 678-228-8900, 678-228-8900, our website, thenutritionshoppe.net. God bless you, and I'll see you back here tomorrow. Take care.